People that are not as afraid of their pain anymore are now prime candidates for the most powerful thing to change pain, and that's movement. People in pain just don't want to move because they're afraid they're going to undo their knee or make their back worse. It's like, no, your back is sensitive because the alarm system is on full alert right now. It's trying to protect you, but there's nothing wrong. Your back is healed. Your back is getting better. Tissues heal, right? So it's the educational model is designed to facilitate people to move, and that's where we really want to get them, because that's actually where the therapy happens. They're just afraid to move.
Yeah, and I think that's an important message. We're not doing tissue damage when we're reinstigating movement and moving the body. And a lot of times if you ask what do you think is going on, they're afraid. Like I had somebody that was afraid that their rib was going to pop out because she had been told she had a subluxed rib from a coughing spell during a COVID bout, right? So she had a COVID bout, she had a subluxed rib, and she was afraid if she moved that the rib would pop out. So not understanding that, there's capsules and there's the joint and there's all this other tissue, and that we could get the muscle spasms to release and get it to feel a little bit better and calm it down, and maybe even get a little audible click, that would tell us that, it's sort of back home where it needs to be. But it was like the fear that something was going to break again, or something's going to fracture, or those things completely changed the movement strategy. And so her movement strategy was one of absolute protection when she didn't need to do that. And so when we were able to introduce the movement to her with very gentle and then progress it to what she wanted to be able to do, she was like, "You mean I've been protecting myself for this last month without needing to?" I said, "Well, it's hard to know. Your body's telling you what it needs. And now we discovered that you can move, so you can move." And she had a really good experience.
But wait a minute, you have now done and explained exactly what's happened to me. And that is, you've come full circle. I was in a podcast recently, and somebody asked me, again, I don't know where the question came, and they said, why are you so good at pain? And I said, because I'm a good manual therapist. You can only, and this is truly become full circle, Brent, because on the one hand, people are sitting here thinking, oh, Adriaan's kind of bashing on manual. No, the part, you cannot talk somebody through movement if you cannot go examine them to make sure that that rib did not dislocate, right? So I have become full circle to say, you know what, I think the reason my patients trust me and respect me and believe me, my education, is because I did a thorough evaluation. And I thoroughly reasoned to show them your rib is okay. It cannot do A, B, and C. And so I think sometimes we think it's either or. I'm either a good hands-on manual therapist or I'm a pain person. No, I think it's those fundamental skill sets, because knowing what you know about ribs and the anatomy and the mechanics gives you the strength to explain to somebody that it cannot do that. That's why we got to do A, B, and C. So again, the message to the audience is obviously all these other educational things we do, from kinesiology to biomechanics to all these other skill sets, are critical parts of building this repertoire, building your persona to give you validity. So when somebody has to make that split second, do I trust Brent and start moving because he just told me the rib is okay? And so I think it's important that those skill sets are there as part of this journey that we're on.
Yeah, that's great. I think that, to me, one of the things looking in the future, and this was part of your presentation in CSM, was how the successful movement experience paired with the education for this particular population really was like an enzymatic reaction. Like it was a catalyst that really put the icing on the cake. Can you talk a little bit more about, the successful movement experience? Because to me, it's like, you just went through the whole thing. Like we have these manual therapy, diagnostic, and now behavioral skills. So let's say that we've acquired this and we've taken somebody to that level. Maybe we manipulated that rib, got a nice little audible correction. They got a relief with it. We taught them about it. We taught them what their experience. But now, to me, one of the most crucial parts, and something that I feel really strongly about, and that's why it was music to my ears when I heard the research being presented at CSM in your presentations with your team, was how valuable movement was as sort of that last piece. It creates the independence. It creates the self-confidence. It overcomes all of these fears that they've been dealing with, having had chronic pain.
Yeah, let's just call a spade today. Education to behavior change is like throwing wet spaghetti to a brick, right? That's Bill Forey's famous quote. We're not going to change a human being's behavior by educating them. We spend $2.1 trillion telling people smoking causes cancer, and 1 in 5 will go, yeah, I should stop smoking. What changes behavior is, in the therapy medical pain realm, is movement. Movement is the single biggest painkiller on planet Earth we've ever studied. I want people to understand that there are studies upon studies to prove it. The problem is just people in pain are afraid to move. They want to move, they should move, but they won't move because they're afraid. What PME does, or CBT, or acceptance commitment therapy, whatever your cognitive bent, motivational interviewing, whatever it is just to get them over the hump where they go, I'm going to be okay. Yeah. And then with graded exposure, for graded pacing, we slowly move them little at a time. But the ultimate goal is not to, we don't explain pain out of people. It doesn't, right. I wish I could. There's maybe been 1 or 2 people that are like, oh my God, I got it, I'm gone. Yeah. You don't.
It's funny that you say that. That study I was talking about, Jeffrey Lackner up in Buffalo, New York, the reason why he came to the conclusion that you could not change the belief pattern or the paradigm was because their intervention was a behavioral intervention. So when I asked him, what were you doing? It was like, well, I'm having them think about lifting that box without back pain. Yeah. And then they went over and picked up the box and they had back pain again. And so it didn't make any difference when I was trying to change their behavior using, cognitive skills. And I thought, well, of course, they just had another negative reinforcing experience with the actual movement that they're afraid of to begin with. And you might create 1 or 2 sessions where they're going to believe you that they can close their eyes and imagine doing the movement without pain. But if you didn't address their strategy of movement or the load of the movement, they're not going to have a good positive experience. Yeah. And all we're doing then is reinforcing the whole, neural chain on that. So